After having a successful breast and cervical cancer screening, Mater Misericordia Hospital has organized a prostate cancer screening camp. The camp will be on 15th November 2020 at Duel Karen between 8 a.m. and 2 p.m. For more information on prostate cancer screening camp, contact us on 0722 231 786 or 0722 318 149. Mater Misericordia Hospital cares.
It is Friday, the 13th of November 2020. Thank you so much for making time for this live discussion. And today being a Friday, as it is a tradition here on Capuchin TV, we bring you informative health talks as well as the best health practices for healthy lifestyles. Now, today, just to mention, last Friday we had an in-depth discussion on food and nutrition with a clinical nutritionist, Felix Okoth. Now today in studio we'll be discussing prostate cancer with Professor Ahmed Kiswezi. Professor, welcome to the studios.
Asante
and
sana.
Welcome to this show.
Thank you very much.
Now tell us a little bit about yourself, Prof.
Professor Ahmed Kiswezi, as you said, I'm a consultant surgeon working at the Mater Misericordia Hospital in South B.
I understand you're also a medical trainer.
I'm a medical trainer. I happen to be training doctors to become surgeons. And this is an exercise which is part of the College of Surgeons of East Central and Southern Africa. And at the Mater Hospital, one of our duties is to train some of our doctors to become specialists. And actually, we are doing so. And this year, we hope to have the first batch graduating, those who have been passed through the Mater Hospital training site, the graduates of the College of Surgeons of Eastern, Central and Southern Africa.
Okay.
Yes.
Welcome. Now, I believe most of us have heard about prostate cancer before, and today we are going to understand more on what prostate cancer is, the prevalence rate, and the chances of survival, treatment, and all that. So, Prof, maybe to begin or to start off, please tell us what prostate cancer is and what part of the body does it affect?
Okay, thank you very much. First of all, I would like to say that the prostate is a gland which is the size, every man is part of the reproductive system of a man, meaning that every man has a prostate gland. It is attached to the, just below the urinary bladder, as the urinary bladder connects to itself to the urethra, which is the passage of urine. At that junction is where you find the prostate gland. It is actually the size of, the normal prostate gland is the size of a passion fruit. Now, this is it is in men because it facilitates the reproductive system, as we know that okay, of course the sperms pass through the same passage and so on. So this gland helps to fortify, and therefore it helps the reproductive system of a man. Now, unfortunately, by God's creation, every part of the body can have disease. Now, the prostate gland one of the diseases of the prostate gland is prostate cancer. And when we talk about cancer, we talk about abnormal cells, which when the cells become abnormal, they don't respond to the signals, they no longer respond to the control mechanisms of the body, so they become abnormal, they are uncontrollable, they behave on their own, and therefore they grow rapidly. And when they grow rapidly, at first for the prostate, they are in the prostate gland, but then later on, as the growth continues, they can even spread to affect other parts of the body. So you may find that after they have the prostate has developed cancer cells, as I said, they are not controllable, they don't respond to the normal the normal control mechanisms of the body, because the body has its control mechanisms which control the growth of the cells, the behavior of the cells. But now these are rebel cells which behave on their own, and so they don't respond to any control. They have their own mechanisms of averting the control mechanism of the body. Now, when the cancer invades the prostate, initially it is within the prostate gland, and at that time it may even not have any symptoms. And that's why some people even come report late, because it doesn't cause pain, doesn't cause bleeding, but the cancer cells keep on growing there. Now, as time goes on, the cancer cells begin migrating to invade neighboring structures. For example, it may invade the rectum, which is nearby. The cancer cells may also invade the vertebral column and the other bones of the body. Eventually, the cells may reach the bloodstream and keep on moving until they even reach the lungs, the liver, and sometimes even the brain. So
this can cause, can lead to cancer of the lungs?
No, when the cancer reaches there, it is not called cancer of the lungs. It is now, in our medical language, we call it metastatic cancer, meaning it has spread, but as it goes to the different structures, it keeps on affecting the normal functioning of the different structures. Right. And therefore, for example, if it is in the lung, the person begins coughing, begins getting breathless, and so on, can even cough blood. If it goes to the bones of the back, you may find that the patient now begins complaining of backache, joint pains, and he cannot even walk with a normal posture. He can even end up with fractures. So as the cancer cells move from the prostate to the different structures cannot function properly, and they now become defective. They can even now, the complaints can now increase to involve different structures.
All right. Thank you very much. So what's the prevalence rate of cancer, especially prostate cancer, in the general population?
Okay, thank you very much. Now, first of all, I would like to say that this condition is worldwide. It doesn't discriminate, although from research, it is indicated that the black population is at a greater risk, because where people have done extensive research, they have found that, for example, in the USA, they have found that the African Americans or the Negroid race, who are like we are at more risk, and this is it's not known why. The disease prefers blacks more than the whites. It doesn't mean that the whites never get it, but the percentage of the blacks who get it is more than that of the whites. Oh. Now, worldwide, the statistics that were done in 2018 indicate that in that year, the new cases of prostate cancer were 1,276,000, only the new cases. And also, when they looked at the deaths, they found that worldwide the total tally of the deaths were 358,000 men who dying from prostate cancer. Now, when it comes to, somebody would ask, how about Kenya? Where are we? Some analysts have also analyzed locally. When you look at the registry of cancer in Kenya, and in the year 2018 again, it was found that for every 100,000 men above 50 years, 17 of them had cancer of the prostate diagnosed. Meaning that now if you have 100,000 men above 50 years, and 17 of them have cancer of the prostate diagnosed, it means that the percentage is high in the population. And now this amounted to, it amounts a big percentage. And again, in the same year, 2018, the statistics show that 2,200 men in Kenya died of prostate cancer, meaning that it is a serious condition. Now, when we talk about this statistics, there's one thing we ask. Is every man tested for prostate cancer when they are in the risk age group? How about those we miss to get? Maybe if we tested everybody, our percentage would be even higher.
Sorry to cut you short. What age group is more susceptible to prostate cancer?
Yeah, the age group that is more susceptible for every man. As I said, that naturally every man has prostate cancer. I mean prostate gland. Now the prostate begins growing bigger and becoming defective after the age of 45 years. And at around 50 years, there are about 20% of men have been found who are 50 and above with prostate cancer. Around 55 years, about 40% men have been found with prostate cancer.
The world population or
world population? These are world figures,
okay,
going by WHO. WHO. Now, but the majority of people who have been diagnosed with prostate cancer are above 65 years. That's when you find that about 70% of the men who have been diagnosed with prostate cancer, they're in the age bracket of above 65 years and above. But also, when you analyze the World Health Organization literature, you'll find that as the age advances beyond 65, the percentage also increases. Meaning that at around 75 years, about 75 to 80% men have cancer above 75 years. Now, and people have said that at 80 years, from 80 to 100 and so on, it is like 80%, 100, 90%, 100%. Or if we are able to live up there. Now, somebody will say, but why is it that people who are 100 years are not diagnosed? Probably our screening is not effective. And the good thing is that whereas it is so, some of the old people may die of other conditions in addition to having cancer of the prostate.
Okay. Thank you so much for that profound explanation. Now, what are some of the risk factors for developing prostate cancer?
Okay, thank you very much. Now, first of all, as I said, age is a permanent risk factor. Therefore, meaning that every man who is above 45 years should ideally be screened for cancer of the prostate, because age is the most permanent risk factor. And as the age increases beyond 65, the rate of prostate cancer increases rapidly. Now, apart from age, also we know that in some families, if you have a close relative, say your father or your uncle, first line, the ones we call first line relatives, who died of prostate cancer, the risk, that means that you have a higher risk than others.
Okay.
Now, it has also been observed that there's a small percentage, about 20% of the disease called familial prostate cancer, where it moves in families, and a number of people, a number of men in the same family would be, their risk percentage increases by 10% if they have a first-line relative who has had prostate cancer. Then there are also other familial cancers, like breast cancer, which is genetical, ovarian cancer, which is genetical. Now, if in the family there has been someone who has been diagnosed with genetical breast cancer or ovarian cancer, and they have said that it is due to the genes, it means that in that family also the prostate cancer risk is high by about a factor of about 10%. Now, also obesity. Obesity, when you are oversized, obesity, and it is even worse when it is associated with the sedentary lifestyle. You are oversized, and every time you are in the vehicle, going to the office, coming back, even going to the supermarket, you drive yourself and you are back, and so on. So when you are back, you eat and sleep, and so on. That is called sedentary lifestyle. Now, obesity plus sedentary lifestyle increases the risk of cancer of the prostate. Eating frequent consumption of red meat consumption associated with the fatty diet increases the risk of cancer of the prostate by about 2 to 3%. Chronic alcoholism increases the risk of cancer of the prostate by about a factor of about 2%. So those are real factors which, yes.
Yeah, just the lifestyle practices.
Yes.
That
now, in addition, of course, as I said, also in our situation, being that we belong to the Negroid race, it is also associated with a higher risk of the prostate as compared to our white counterparts.
Thank you very much. We are taking a very short break. We'll be right back with more on prostate cancer.
After having a successful breast and cervical cancer screening, Mata Misericordia Hospital has organized a prostate cancer screening camp. The camp will be on 15th November 2020 at Duel Karen between 8 a.m. and 2 p.m. For more information on prostate cancer screening camp, contact us on 0722 231 786 or 0722 318 149. Mata Misericordia Hospital cares. Jumapili hii tarehe 15 Novemba, Capuchin TV tutaungana na waumini wa parokia ya Mtakatifu Andrea Mtume eneo la Rironi, dekania ya Limuru katika jimbo kuu Katoliki la Nairobi kwenye sherehe ya siku ya familia ama Parish Family Day. Pia watazindua ujenzi wa kanisa jipya la parokia. Ibada ya misa takatifu itaanza saa 5 asubuhi ikiongozwa na Mwadhama John Cardinal Njue. Jiunge nasi hapa Capuchin TV na kwenye mitandao yetu ya kijamii. Liturujia Katoliki, sakramenti, kuungama, ekaristi, sala, nyimbo, neno la Mungu, ibada takatifu. Jiunge nasi kila siku ya Jumapili saa 1:30 usiku na Jumatatu saa 4 asubuhi kwa liturujia Katoliki na Padre Boniface Mukwe. Sakramenti ni nini na misingi yake iko wapi katika Biblia takatifu? Wavijua vipindi vya kanisa Katoliki? Ni alama na vyombo gani vinavyotumika katika maadhimisho ya ibada zetu? Ungana nasi kila siku ya Jumanne saa 1:30 jioni katika kipindi cha Sakramenti na Biblia. Ni kutoka hapa Capuchin TV, tukiikuza imani Katoliki kwa pamoja.
Hail, Holy Queen, Mother of Mercy, hail our life and sweetness and our hope. To you do we cry, poor banished children of Eve. To you do we send up our sighs, mourning and weeping in this valley of tears. Turn then, most gracious Advocate, your eyes of mercy toward us, and after this our exile, show unto us the blessed fruit of your womb, Jesus, O merciful, O loving, O sweet Virgin Mary. Amen.
To get Hail Holy Queen as your skiza tune, send skiza followed by code 738-10258 and send it to 811. Capuchin TV, a Catholic broadcasting ministry. Misa takatifu ya kila siku ni kama ifuatavyo: saa 1 kamili asubuhi, saa 7:30 mchana, saa 12 jioni na saa 2:30 usiku.
Go forth, the mass is ended.
Thanks be to God.
Mpenzi mtazamaji, tunakuenzi na kukudhamini.
Endelea kutazama Capuchin TV.
Welcome back to this live discussion on prostate cancer. Being the second session of this discussion, I'm in studio with Professor Ahmed Kiswezi, a general surgeon as well as a medical trainer at Mater Hospital. Now, this being the month that Mater Hospital has set aside to create awareness on prostate cancer, we have brought you this live discussion to enlighten you more on prostate cancer. Professor, I know in the first session you mentioned some of the signs and symptoms of prostate cancer,
yes,
like the swelling of the prostate glands and the bleeding. What are some of other signs and symptoms that can tell someone that they could be having cancer of the prostate?
Thank you very much. Now, anatomically, this gland is situated at the junction between the urinary bladder and the urethra. This means that when the prostate is affected, the urinary passage becomes ineffective. So the patient will begin having the first signs being difficult, increasing difficult, progressive difficulty in passing urine. And this may be associated with as time goes on, of course, initially the stream becomes poorer until the patient begins urinating between his legs. Eventually, the patient now begins having drop, instead of urinating with the stream, it becomes drop-wise. Like he's counting drops. And there's a straining on passing urine. Now, at night, there's also frequency, meaning that the patient will urinate many times a day. And in addition to this, there will also be urgency. It's like a sudden need to pass urine. When you need to pass urine, it comes suddenly, and if you delay, it may even it may wet your trousers. Now, in addition to that, at night, the passing of urine increases. The rate of urinating at night increases seriously, maybe to more than 6 times at night. These symptoms are almost similar to those where there is no cancer, where the prostate is just enlarged, but there's no cancer, but they are similar. Now, in addition to that, in cancer of the prostate, there's unexplained weight loss. Somebody begins losing weight without a proper explanation. Even if he eats very well, he finds he's losing, his body weight is dwindling slowly, progressively. In addition to this, of course, there is occasionally there's blood in urine, and unexplained drops of blood in urine, sometimes even passage of frank blood. And this now is that's when the patient now begins getting worried. Now, one thing we should note in this condition is that in many patients, there are no symptoms. And that is a risk to the listeners. I would like to emphasize this, that in about 50% of patients who develop cancer of the prostate, they don't have symptoms until it is very late. And that is a big risk, because by the time they come, you find that the cancer of the prostate has spread to involve other structures. And so at that time, it becomes a very serious condition.
What's the best way to stay on a safer side? Now,
the best way to stay on a safer side is for every man who is above 45 years, to at least once if you are between 45 and 50, once a year you should be checked for prostate cancer. And if you are above 50, ideally twice a year. For those who, it is even more so for those who are 65 and above. The checking of the prostate cancer should be more than once a year, because it can be hidden. Many times for us in Africa, why we even we diagnose the prostate cancer late, and at that time we don't have a chance to cure it.
Right.
Yet, if it is diagnosed early, we can either remove the prostate surgically or give drugs to ensure that this cancer is suppressed, and therefore your life expectancy increases.
So how is this prostate cancer diagnosed? How is it diagnosed?
Now, we usually, when it comes to diagnosis, we usually take the history of the patient. Sometimes we are, in a number of people, about 50%, we are able to pick the difficulty in passing urine, sometimes with the occasional loss of weight. There may also be frequency at night, blood in urine. But in addition to that, as I said, that many patients may not have any symptom or sign. We also go ahead and examine the patient. We examine the prostate, first of all, clinically. We assess. We are able to touch we usually, using our gloved fingers, we are able to touch the prostate gland. And when we touch, we are able to know that now this prostate is suspicious of cancer, because a prostate which has cancer is not only, it may be enlarged or moderately enlarged, but it is hard to touch. It also has nodules. Now that is a ring, it rings a bell that, oh, this prostate could be suspicious of cancer. In addition to that, we also go ahead and take off blood. And in the blood we test, there is something that we call prostatic specific antigen. Prostatic specific antigen in a patient who has cancer, it keeps on rising. The normal level in people who are around 50, between 50 and 60 years, the normal level is up to 4 nanograms per deciliter. Now, if the prostate has been affected by cancer, the prostate specific antigen keeps on increasing until it reaches very high levels. And for us, when we find that the patient's prostate specific antigen, which is that's the blood test, when we find that it's more than 4 nanograms per deciliter, we further assess the patient by doing biopsy of the prostate. And when we do biopsy of the prostate, we take it for pathological analysis, where they may tell us that, okay, there are cancer cells or there are no cancer cells. But in addition to that also, the pathologist will go ahead to say, if there is cancer, it is this grade of cancer, because we have a grade which we know that, oh, this grade can rapidly progress and spread the whole body.
So the PSA is naturally in the body system?
The PSA is naturally in the body. And their mechanisms, of course, it's not like 1 + 2 = 3. But for us in the clinical sphere and in the laboratories, we are able to interpret it. So it is advisable that even it's not advisable for the general population to just walk in a lab and say, I want PSA test, because the interpretation is by the clinician.
Okay. All right. So now it is said that, or rather it is believed that the earlier the diagnosis, the higher the chances of treatment, and therefore the higher the chances of survival. What is the percentage of prostate cancer? What percentage of prostate cancer are diagnosed early?
Now, okay, fine. Thank you. This is a very important question, because it hinges on why we should make efforts to be diagnosed early. In comparing figures, in the United States, about 90% of their patients with prostate cancer are diagnosed in early stages. That means that at stage 1, there's also a stage called cancer in situ, meaning cancer cells are beginning, but they have not even spread. They have not started even becoming a swelling. It's called cancer in situ. That is one stage. I mean the earliest stage. Then also stage 1, stage 3, 2, 3, 4. Now, for us, when cancer is diagnosed early, it means that the patient will be diagnosed before stage 2, before stage 2B. And at that time, if surgery is done for this patient to remove the prostate and its capsule, it is curative. If surgery is done and the patient is also followed up with some medications, this 5-year survival can be up to around 98%, as it has been reported in the United States and in Europe. Unfortunately for us in Africa, especially in East Africa, we are now diagnosing our prostate cancer when it is stage 3, stage 4, meaning it has, when stage 3 means it has spread, it has involved almost the whole prostate. It is almost encroaching the borders. And stage 4 means it is even throwing its cells to distant structures of the body, like the bones, like the liver, the lungs. Now, we wouldn't want, it is not desirable for a doctor to diagnose a patient whose cancer has gone up to stage 4, because around that time, you'll have a very little chance of helping the patient survive for the next 5 years. Now, in our setting, because we diagnose patients late at stage 3, stage 4, our 5-year survival rate for prostate cancer is about 10%, which is not very good. So the appeal is, if we are able to make our diagnosis of prostate cancer when it is at stage 1, stage 2A, we can increase our survival rate also to around 90%.
Thank you so much.
But remember that, as I said, prostate cancer at the early stage, most of the patients don't have a single symptom. So the question is then, how can we achieve this? This should be achieved by ensuring that every man who is above 45 years should endeavor to go for testing, for a clinical examination to rule out prostate cancer.
Thank you, Prof. So how is this cancer of the prostate treated?
Okay, fine. That's a good question. Now, in the treatment, we have 2 arms, or 2 objectives. If the patient comes early, as I said, before the advanced stage, the treatment can be surgery, where you pick the whole prostate out, and this will be curative.
All right.
There is also, when the patient comes and they say the problem is obstruction, bleeding of the prostate, and so on, and when we find the cancer at that stage, we may help him to pass urine. We may unblock the passage of urine by surgery, and then leave the patient to continue with drugs, but this will not be curative. That means that the patient will be living with the cancer, but we shall be treating now using drugs and then radiotherapy. Now, the drugs have different, we have different classes of drugs. First of all, I would like to say that this cancer of the prostate, its growth is highly facilitated by male hormones called androgens. Male hormones called androgens, they are the ones which encourage and facilitate and fertilize the growth of the cancer.
So now,
some of the drugs block the function of the androgens. Some of the drugs block the synthesis of the androgens. And some of the drugs are the usual anti-cancer drugs we have, and the chemotherapy.
all right. Now, is there a way someone can prevent themselves, people can prevent themselves from getting cancer of the prostate?
Okay, thank you very much. Now, first of all, over the years, even with a lot of research, the prevention of prostate cancer is still a scenario worldwide. There is no golden ball which you throw and say, I've now prevented the cancer of the prostate. Because even the causes themselves, apart from age, they are still under a lot of study. However, there are efforts which should be made to mitigate the occurrence of cancer of the prostate, one of which is frequent checking in the clinics, especially as the age advances. So that if there are drugs to be given, you can be given some drugs to really mitigate its propagation. Secondly, let us check on our body weight and control our, and also perform exercises to avoid sedentary lifestyle. Because as I said, sedentary lifestyle is highly associated with this disease. Efforts should also be made to avoid frequent consumption of red meat. Vegetables, fresh vegetables and fruits, plus exercise are protective, although not preventive, but protective. They can protect you against this kind of condition.
Thank you so much, Prof. So now a number of recurrences have been reported in patients who have been diagnosed, treated, and declared cancer-free. Why is it so?
Now, this is also a good question. Thank you very much. Now, first of all, when we make a diagnosis of prostate cancer and then the patient is put on treatment, for us as clinicians, we should make efforts to explain the patient what stage of cancer it is and what kind of treatment they have undergone. As I said, radical prostatectomy may be curative, but apart from that is when the patient has come early. When the patient has been diagnosed late and they has been put on treatment X, usually that means that the patients will stay with the cancer. Now what the drugs do is to suppress its propagation. Unfortunately for our patients, when the symptoms subside, the patient walks away thinking he's cured. And when they default treatment, there's recurrence. When some of the patients divert from medical treatment to many other alternatives, Chinese herbal, they are in traditional African herbal, they are in this and that. And then when they do that, they give the cancer a chance to recur because those drugs have not been researched on, those treatments have not been, there's no evidence that they work. So they come back to us when the cancer has recurred. Now, the other one is, that is defaulting and then using alternative treatment that are not reliable. And then, of course, the other one is that at times when we do, for example, surgery at any one time, take, for example, patients who have had prostatectomy because of enlarged prostate. This is not assured you that you will never get cancer of the prostate. Even after removing the prostate, you can still get cancer of the prostate because when we remove cancer of the prostate because of something else which is not cancer, like a benign prostate hyperplasia, we leave around the capsule. And when the cancer of the prostate begins from the capsule, and you can still get cancer even after prostatectomy.
So is this recurrent cancer of the prostate curable? And if it is curable, what are the chances of survival?
Now, it depends on the presentation of the patient. As I said, if the patient was diagnosed and then they went for alternative treatments, sometimes they come to us when they have distant metastases. You have the cancer of the prostate, but the bones are affected. You have the cancer of the prostate, but the liver is affected, the lungs are affected. Now, in this kind of situation, the cure rate, we even manage to help the patient. We can only manage to help the patient live for some more months or years, depending on the level of spread of the cancer.
And can a cancer victim who has been declared free from their prostate cancer, can the man still remain reproductively functional?
Unfortunately, when we remove the cancer of the prostate, unfortunately, the fertility rate reduces because now they get complications. When you remove that prostate, as I said, it's part of it is at a junction in which where also the sperms move to exit for reproduction. Now, when you remove the prostate surgically, the fertility rate reduces because many times the men end up with the retrograde ejaculation. And then the sperms also, because one of the functions of the prostate is to facilitate the speed of the sperms. Now, when it is removed, the speed of the sperms reduces, and therefore many men, after removing the prostate, they are not able to produce.
Now, has the survival rate of patients diagnosed with prostate cancer improved over time?
Yes, but I will say yes and no. For those who are diagnosed early, which we usually emphasize, the survival rate, the 5-year survival rate improves quickly. Now, we are looking forward to a time when we shall also achieve the numbers of the European or the Americas. For them, they are around the 98% survival, 5-year survival rate for the cancer, because the cardiac cancers are diagnosed early, and therefore the treatments are given and the patients can survive longer. Now, unfortunately, for as long as for us here, we are still diagnosing our cancers a bit late, stage 3, stage 4. Now, when this prostate cancer is discovered late, diagnosed late, whatever treatment you give, the 5-year survival rate is not more than 40%.
Thank you so much, Professor. I'm told time is against us, so briefly, in a few seconds, give us your final remarks.
Now, I would like to, first of all, thank you for this enlightening interview, because it is a very good message to our listeners. This disease is over worldwide, but the African population is affected, partly because of lack of awareness, and because we don't take time to go to the clinics for checking. Now, this Sunday at the Mater Health Center at the Well Mall, Karen, we are going to hold a prostate screening camp, and I'm calling to all who are listening to turn up in large numbers. Every man who is above 45 years, don't miss this opportunity to be checked so that you have the screening. As we said, we are part of a worldwide, this month, November, is usually the worldwide prostate cancer awareness month. I would like to appeal to our people, the men, to come and get screened for prostate cancer, because you never know. You may be thinking you are safe when you are not. So this Sunday on the 15th of November at the Mater Health Center at Well Mall, the exercise will go on right from starting 9 a.m. to 5 p.m. You are welcome. Karibu wote.
Thank you very much, Professor, for your time and for being here with us on Around the Table Talk Show. Now, we have come to the end of our live show on prostate cancer. Today in studio, I had Professor Ahmed Kiswezi, a general surgeon and a medical trainer. Now, you have heard all it from the horse's mouth. You know what to do to keep safe and try to prevent yourself from developing prostate cancer. Now, thank you so much for your time. I'll see you next time on Around the Table Show. Same place, same time. I'm Asasha Elizabeth. See you then.
After having a successful breast and cervical cancer screening, Mater Misericordia Hospital has organized a prostate cancer screening camp. The camp will be on 15th November 2020 at the Well Karen between 8 a.m. and 2 p.m. For more information on prostate cancer screening camp, contact us on 0722 231 786 or 0722 318 149. Mater Misericordia Hospital cares.